Hi, my name is Sahara.
I'm Kelly.
I'm Brianna.
I'm Leslie.
Susanna.
Rachel.
Jessica.
And I'm Kelsey. And we're presenting on pediatric growth and development.
By watching this video, we hope that you'll be able to list Erickson's 5 stages of development,
Recognize appropriate milestones throughout the pediatric lifespan.
And describe 2 patient education points to promote normal development throughout the pediatric lifespan.
Developmental milestones are key to promoting normal growth and development across the lifespan. Developmental milestones serve as checkpoints that help identify potential delays in infants and children. Specific developmental milestones occur at specific time periods. Early identification of developmental milestones can help allow for early intervention and prevent possible complications.
We'll be focusing on 3-month periods. During this time, infants are learning if their needs are being met or not. If their needs are being met inconsistently or not at all, they will learn mistrust. This correlates with Erickson's stage of development of trust versus mistrust. So at age 3 months, they should be able to hold their head up on their tummy. They should also have good head control. These are both physical milestones. For a social milestone, they should be able to smile at this age. For language, they should be able to turn their head towards sound. For cognitive milestones, they should recognize people at a distance and be able to follow objects with their eyes.
By 6 months of age, physically they should be able to roll over from their tummy to back and vice versa. They also should be able to sit unsupported without the guiding hands of a parent. Muscles should be toned and they should not be stiff or floppy at all. Socially, the infant begins to recognize strangers at this point. Anyone such as a parental friend or grandparent who's not the mom or dad. They also are able to respond to people's emotions at this time period, such as smiles, laughs, cries, or any sort of other emotion. Language at 6 months of age is characterized by making simple sounds and laughing. Cognitively, the infant is beginning to explore their environment by bringing things from their hands and placing them in their mouth. This helps them to gather information through touch and taste.
At 9 months of age, they should be able to bear weight with their legs, as well as to stand with the support of a guiding hand. They should also be able to crawl. These are all physical milestones. For social, they should be afraid of strangers at this age. For language, they should be able to babble, and they do understand the word no. For cognitive development, they can pass things from hand to hand, and they should also have that fine pincher grasp.
By 12 months of age, or 1 year, the infant should be able to stand with minimal assistance. They also should be able to move from a lying to a sitting position without the help of an adult. Language at this point is characterized by single words, such as mama or baba. They also are able to mimic or start showing simple gestures, such as waving bye-bye or saying hello to people. This period is also characterized by continued exploration, investigation of their environment around them. So you'll notice that they'll be shaking things, throwing things, or handing things off to people. At this point, a 12-month-old is also able to point, and they will begin to search for hidden objects in the environment, such as a box or any sort of toy that's placed behind your back. Next, here's a video that we have of a 12-month-old infant to help you visualize some of the developmental milestones during this time period. See how many developmental milestones you can identify. Here's a list of the developmental milestones you should have been able to identify in the video.
La 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 la. Patty cake.
Mama.
Bye, Micah. Bye, Micah. Bye. Bye. Patty cake. Patty cake.
Next slide will show you some of our interventions that you can do for this age group.
As we move out of infancy, children are considered toddlers after the age of 1 all the way up to age 3. The main task of toddlers is characterized by Erikson's psychosocial stage of autonomy versus shame and doubt. Toddlers begin viewing themselves separately from their parents, which gives them the desire to explore their environment. Donna, a mother of 2 toddlers, ages 1 and 3, is here to help explain the life of living with 2 toddlers.
Lots of things that he does, we continue to encourage him to do it on their own.
Under supervision, it's important to allow them to make their own decisions and carry out tasks by themselves, using positive reinforcement and avoiding negative language such as "don't do that." For example, allow the child to take off his or her own shoes, even if it might be quicker if the parent does it themselves.
You know, like Cooper's putting on his shoes. And so for a long time I've been doing it, and we just slowly started saying, hey, you try. And one day, just last week, he's like, Mommy, I did it all by myself.
As a nurse, instead of asking the toddler, can you take this medicine, give them a choice by asking, do you want to take this for me or Mommy? Although toddlers like to venture out by themselves, separation anxiety can occur if they are away from their parents for too long. Nurses should encourage parents to stay by the bedside and help with toddler care during hospitalization. Another important task for toddlers to accomplish is controlling body functions, especially through toilet training. This usually begins around 18 to 24 months with recognizing the need to go and communicating this sensation with their parents.
For our child and for our lifestyle, we're pretty flexible, so we'll do it all day until like evening time, or for when he gets back from the sitter at times.
Another way toddlers show their autonomy is through negativism. They often say words such as no or me do,
But this is my castle.
and have mood swings and temper tantrums. It's important for caregivers to be consistent with their set rules and limits for the child. Rather than criticizing their bad behavior, explain what you would like them to do instead.
We try to be consistent, and with Zoe, I let her throw a tantrum. She's not going to get a response from me, and that's what she's looking for. And I let her do her thing as long as she's safe, and she kind of picks up and moves on.
Physically, toddlers become more advanced in their movements by being able to jump up with both feet and stand briefly on one foot, as Zoe does here. They advance with their ability to use their pincer grasp by picking up small objects and throwing them, along with holding a pencil and scribbling, drawing circles, and creating lines. Cognitively, they are egocentric, meaning they can only view things from their own perspective. You may notice toddlers participating in parallel play, in which they play next to each other rather than with each other, as Zoe and Cooper are demonstrating here.
One example would be in our living area, we have some old Fisher-Price, like a house and a barn and a tree house, and we have all these little people, and he'll stay off to one side and play in the barn area, and she'll have the house.
According to Dr. Keeley, a developmental pediatrician, the most important milestone for a toddler to accomplish is to be able to say at least 2 words by age 2. Lastly, as caregivers, ritualism is important for toddlers. Nurses should ask parents about usual routines for the child at home and implement these into their hospital routine. If a toddler becomes uncomfortable and scared in the hospital, regression can be expected and should not be shamed, but rather other achievements should be encouraged. To recap the growth and development of toddlers, here are some key points to remember.
Mommy, is this my punishment for being mean to you? No, sweetie, you're in the hospital because your stomach hurt.
Hi.
Hi.
Hi, Jessie. How are you?
Good. Mommy, can I play with Luke in the hospital?
Is Luke his imaginary friend?
Yeah.
Great. Luke can help us make you feel better.
Okay.
All right. First, could I have you say "ah" for me? Great. Looks like you have all of your baby teeth grown in. All right. Now we're just going to listen to your heart and your lungs, okay? Okay. Here we go.
Okay, Jesse, everything sounds great. Now that we're all done with that, we can play with your toys now.
Jesse, I got you this toy from the gift shop. Now, when we get home, you have to make sure to share it with your sister, Sarah, okay? Okay, fine.
You can play with your new toy, or you can play in an airplane. You want to pretend to be in an airplane?
Yeah, let's fly to Disney World!
All right, great!
According to Erikson, preschoolers are in the initiative versus guilt stage. This means they purposely interact with their environment and they start to learn proper behavior. They also feel like everything bad that happens to them is their fault. So, like for example, in the skit, you saw that the first question Jesse asked was, "Am I in the hospital because this is my punishment for being mean to you?" So they think that everything bad that happens to them is their fault. They start to also take responsibility over their own actions and behavior. Physically, all their baby teeth are developed, so the nurse assessed Jesse's baby teeth and she said they were all in. Fine motor skills are developing and they are more active at this age, and they also need 12 hours of sleep a day.
Cognitively, preschoolers are much more imaginative. Jesse wanted to pretend that he was in an airplane, as you saw in the skit. They like to pretend, and they have animistic beliefs, so any inanimate object they like to add feelings and thoughts to. They are egocentric, but start to become less egocentric as they get older. They start to talk in 3 to 4 word sentences at age 3, 5 to 6 word sentences at age 4, and longer sentences at age 5. They can understand others better and can be understood by others as well. Socially, they start to share. Jesse was instructed by his mother to share with his sister, and he eventually agreed to. They like to make-believe play alongside their cognition and liking to pretend. They start to learn their table manners, and they are also more active in running and jumping, as well as coloring and playing dress-up.
To watch some footage from a conversation I had with 10-year-old Nevaeh. Pay attention to the different forms of language she uses and the differences in conversation of a school-age child compared to the previous kids you've seen. What do you like to do in your free time?
Play with dolls.
Okay.
Read. Watch Netflix and YouTube.
What about when you're with your friends? What do you guys like to do when you're together?
Joke around.
What does that mean?
You know, talk about stuff that goes on.
Like mostly at school?
Yeah.
Stuff at school?
One time I made a funny joke because there was pants in the lost and found. Now we always have this pants joke where we're like, oh no, I lost my pants. I'm not in charge of locking the door anymore because one time we closed the door and then I guess it bounced off, but it was cracked open a little, and when we went home, when Bree went to open the door, it actually did open and she didn't have the key. So we had to have a neighbor, but nothing happened. The door just bounced off. So I'm not in charge of that anymore.
What are some things that you're really good at?
Singing.
Singing? Did you have to work to get good at that, or is it just natural talent? Natural. Is there anything that you're just terrible at?
PE. I cannot do a push-up. I'm pretty good at sit-ups, but I cannot do a push-up.
Okay, you just finished watching a video of Nevaeh, who is 10 years old, and I just want to point out a couple things that you should have noticed in the video. So first of all, her physical aspect. The school-age kids have grown in height and weight, but they've slimmed out a lot compared to when they were younger. They've also lost their baby teeth, or are losing their baby teeth at the beginning of the stage, and grow their adult teeth. They also like to use their hand as a tool, so she was drawing and was able to talk at the same time. They're really active, and they like to run and jump and skip and all of that. And they should receive at least an hour of vigorous activity a day to get all that energy out. School-age kids think a lot more concretely than in the past, and they can use language to express their feelings and to tell about events in their lives. Nevaeh was able to tell detailed stories about how when she forgot to lock the door to her house or when she got in trouble at school, and she was able to use the past, present, and future tenses to talk about these things. So school-age kids are in Erickson's stage of industry versus inferiority, which means they want to master their skills, new skills, and when they're unable to, they feel incompetent and like a failure. So Nevaeh said that she is really good at singing and not so good at PE and push-ups. So one of the important things about this is that they're not going to be good at everything they do, but they need to have certain areas where they feel like they're competent and they're skilled to make up for the ones where they're. So in nursing, let the kids be involved in their care and teach them along with the parents about their disease so that they can participate in like the chronic care if they have a chronic disease. Finally, social interactions are really important at this age. Their friends provide them with new viewpoints of life outside of their family and help the kids become less egocentric. So peer pressure also starts to play a role with appearance and actions. So one of the things you can tell parents is to provide outlets for their kids that are positive and will promote positive outlets for their children's energy and curiosity, and also to be involved in knowing about their children's friends.
So Rachel, I think it's time to talk about your future. What college do you want to go to? What careers are you interested? Do you have a plan?
I'm just a kid. I didn't think I had to think about this yet.
Well, Rachel, you're getting older now, and it's time to start looking into your future. It'll be here before you know it.
Hey Rachel, do you want to come to a party tonight?
What kind of party?
You know, like no adult's gonna be there. We have a cabinet full of liquor. Gonna just totally destroy that thing.
But my mom told me I wasn't supposed to drink until I was 21.
Don't be such a loser, Rachel. Who listens to their mom anymore? Just tell her that you're sleeping over at Jessica's. She's a goody two-shoes. Your mom would never find out that you're gonna be drinking at our party.
I don't know. Yeah, I guess I'll come.
All right, awesome.
Hey Mom, can I ask you a question? Sure, anything. Some of the girls in gym today were talking about getting their period, and what is that? I mean, what is it?
Well, honey, you are, going through a certain time in your life where your body will be going through some changes. This is called puberty, and during puberty, you'll, start having your monthly period, like some of your friends have, and during, every month, you will have, some bleeding. But don't be alarmed. I'll be there for you, and I'll help you through it when it happens, and I'll show you what you should do. Also, you may have some other changes in your body, like your chest might get bigger, your hips might get bigger, you may have some weight changes, things like that. Don't worry about it. I'll talk you through it, and we'll get through it together.
They were also talking about doing gross things with their boyfriends, and it just,
Okay, well, honey, like I said, with these changes in your body, you'll also have, feelings that you, in your body that will be changed. Like when a girl likes a boy, and she spends time with him and really likes him, she might want to, act on those bodily feelings, and like things like mommy and daddies do, like kissing or anything like that. And, but those things are only supposed to be between like a husband and wife, like me and your dad. And I know it's gross to think about, but, even if your friends are doing it, and even if it looks cool or they say it's fun, we really, me and your dad both, we would encourage you to just wait on those things until, you find a husband of your own.
Sure. Thanks, Mom. I'll do that.
The last 3 skits you just watched are, going through the changes that adolescents experience. The first skit you saw between the counselor and the student kind of describes the identity versus role confusion stage. The counselor is, telling the student that she has a lot of things coming up. She has to think about her future and her jobs and everything. While the student is, still confused because, they feel like a kid and they know that they have a lot of responsibilities coming up and they're just not ready for it. The second skit you saw, was explaining peer pressure, which a lot of, these teens go through. They want to be accepted by their friends, and, so this one teen, is telling her she's only cool if she goes to this party, but she feels conflicted because she knows that the things that they're doing there are wrong, but she agrees anyway because she wants her friends to accept her. And then, in the last skit, it explains, some of the bodily changes that females and, males do go through. But this one's for the female, things with puberty and the changes that she'll go through, and, males still do, go through the same changes, and, they're different changes, but they still will experience some changes throughout their body during this time.